The death toll from the COVID-19 pandemic has risen to 92. The 2 additional deaths are males, both with pre-existing medical conditions and 1 elderly. Meanwhile, 15 more people have tested positive for the virus. This brings to 1,715 the total number of active cases. There are currently 105 patients in hospital. 58 of them are at the Couva multipurpose facility, with 4 in ICU and 6 in the high dependency unit. At the Arima Hospital, 3 patients are in ICU. There are 25 patients at the Cora Hospital and 19 at the Scarborough Regional Hospital at the fort. Trinidad and Tobago will continue to act based on the state of the COVID-19 virus and will move cautiously towards easing lockdown measures. The position of this country, as stated by Chief Medical Officer Dr. Roshan Parasram, and follows a recent statement from the WHO warning against using the lockdown to prevent the spread of the virus. Sunil Lalla has more.
We in the World Health Organization do not advocate lockdowns as a primary means of control of this virus.
The recent statement from WHO official Dr. David Nabarro sparking questions worldwide about the legitimacy of lockdowns to stop the spread of the coronavirus. He recently indicated that the only time a lockdown is justified is to buy a country time to reorganize, rebalance its resources, or protect its exhausted healthcare workers. Dr. Nabarro also pointed to the effect lockdowns have had on the tourism industry in the Caribbean, as people are unable to go on vacations. But Chief Medical Officer Dr. Roshan Parasram responded, saying Trinidad and Tobago has already begun to ease its lockdown measures and will continue to do so in a calculated manner.
We are in a state, I think, in Trinidad and Tobago where we are in process of coming out of lockdown. Every country needs to do what it has to do, given its resource and given the present epidemiology of the virus, or as it progresses through the country.
But Dr. Parasram said as the country begins to relax measures, the adherence to COVID-19 guidelines will be critical, but noted that people have not been wearing their masks properly, which can increase the risk of getting infected.
If, however, there is congregation, as has occurred in the past, without mask wearing, with persons being ill going into different environments, we expect increases in the number of viruses. As simple as once we have non-adherence and you have congregation, you will get a spike in the viral cases.
Meanwhile, the Chief Medical Officer also commented on the increase of the number of flights between both Trinidad and Tobago, saying it is critical for anyone with symptoms not to travel so as to limit the inter-island spread.
It really depends on who we have moving between the islands. If you recall, a few months back, we would have had one individual who was exhibiting flu-like symptoms, basically later turned out to be positive for COVID and had gone to a particular hotel, and their contact list was upwards of 100 into 200 persons.
Dr. Parasram said this country's main goal is to prevent loss of lives and will continue to move slowly and cautiously towards easing lockdown measures. Sunil Lalla, TTT News.